Today's Pet Advice segment is sponsored by University Veterinary Care Center. This morning, we welcome Dr. Travis Gratton with University Veterinary Care Center. Dr. Gratton, good morning.
Good morning.
Well, we're continuing our conversation on deaf pets. Now, our viewers may recall last time Dr. Utt was here with Annie, sweet little Annie, and she was showing us how she communicates with her deaf dog. So let's talk more about the testing for hearing on animals and that process.
Yeah, it's a little more limited in veterinary medicine than it is in humans. We don't have them tell us which frequencies and at what what level of
Right.
sound they can hear, so they don't raise their little paws when the left ear or the right ear. Not as practical. We are more interested in can they hear, and then you can look into why can't they potentially. But the testing itself is called BAER, B-A-E-R, Brainstem Auditory Evoked Response, and it's basically a little very simple EEG test where there's some electrodes applied on the skin, on the head, and then a little earphone that goes in, and it does a repetitive little clicking noise. And if there's an electrical stimulus made in the inner ear that goes into the nerves of the brain, it produces a very typical waveform, and you can see kind of where either it starts or where it stops, or in the case of Annie, it's kind of just a little baseline flat line with no response. And you can test left ear, right ear, and see if they have hearing in one or the other, or neither, as in Annie's case.
Well, and we have a couple photos of Annie getting her hearing tested. So obviously this is for dogs. Does it work for other types of animals as well?
It does. Cats certainly a little more reluctant to let you stick something in their ear that makes an annoying little click if they can hear. The electrodes, though, certainly, because it is just nerve impulses firing into the brain stem, really can work on just about anything. So it's very simple. It's actually the same testing that's done in newborn babies in the hospital. Theirs is a little higher tech, but it is essentially the same thing that is done on day one of infants.
Very interesting. What could be some of the different causes of deafness in a pet?
Most of them are, or at least most of the ones we're screening for tend to be the breed-related genetic problems, and that tends to be the biggest category. As Dr. Utt said, if you have a dog and you live with it, you kind of know that it's deaf or it's losing its hearing as it ages. We are usually looking at dogs who are puppies, where we're screening them when they're relatively young before they go to their new homes out of breeding programs. Some rescue dogs where people may go, oh, I don't know if this one can hear. We can certainly test that and go, yes, can hear some, can hear in one ear, or no, we're deaf, and then the conversations of how we deal with living with those, like Amanda covered last week.
Any final thoughts on deafness in animals? If somebody maybe suspects that their cat or dog might have a hearing problem, kind of next steps, what they should do? Yeah,
certainly it is a little limited in who does it, and so not every veterinarian does it. We do, because we do a lot of high-end breeders across the Midwest, and my sister is actually an audiologist, so she did train us. I should give a shout out to her. But seek it out. It is there, and even outside this area, there are neurologists and the referral centers at some of the universities that do it as well.
Okay, helpful information, Dr. Gratton. Thank you for being with us this morning. And if you'd like more information about University Veterinary Care Center, just head over to universityvetcare.com.